Good morning, friends of the media. Thank you for coming to the press briefing. The Chief Executive will first say a few words and then she'll take questions from the floor. Now can I invite the Chief Executive to speak? Friends of the media, members of the public, last Friday at the press conference, I made an appeal to the public to remain patient because there are several important tasks we are carrying out in this week. And of course, by midnight tonight, a series of social distancing measures will expire. I could, give you advance notice. Later today, we're going to announce the latest round of social distancing measures. Well, perhaps I could briefly recap the 5 areas of work I mentioned last Friday at the press conference. I'll give you the latest update. First of all, we are going to monitor closely whether the downward trend of daily infected cases could be sustained. Of course, the number may fluctuate a bit from day to day, but the overall trend is one of a downward trend. And since the press conference on Friday, there have been 4 more days with records of cases. On the 27th, there were 27 cases, 23rd of August, 27 cases, 24th of August, 26 cases, 25th of August, 25 cases, and last night we had a single digit, yesterday we had a single digit number of cases, 9. So for confirmed cases, now around the world, including the mainland and many other countries, it's hard to prevent imported cases altogether. So the focus is more on local cases. If we stop imported cases, that means we won't allow nationals or residents to go home. Now here, then this trend is reassuring, but of course we're only seeing this trend for several days. A second aspect of work, now there were 2 clusters of concern. One is the container terminal clusters, the other is the cluster at boarding facilities for foreign domestic helpers. So we believe, that's why we said we're going to do testing and follow-up work for the container terminal case. We have distributed bottles. Over 90% of the bottles have been returned, and we have tested so far 6,900 samples. We've not identified any new cases. Now, for the higher risk workers at container terminal, we've decided to do repeat tests regularly. We want to make sure there won't be infection in a cluster. And then second cluster, that is foreign domestic helpers in between contracts. Now, because of the spike in cases, we have taken stringent measures to suppress the number of foreign domestic helpers coming to Hong Kong. Every day we just have a few dozen for FDH coming to Hong Kong. But of course, many families do need FDH to take care of their children or the elderly. Now, we're talking about FDH who've completed their old contracts and they are about to move to the next contract. Now, the usual practice is for these FDH to go home first before they come back in between contracts. But now, because of the epidemic, we allow FDH to stay in Hong Kong as they wait to start their new contract. So the Immigration Department has been trying its best to speed up the processing of such new contract applications. In the past, it would take 4 weeks or so. Now they have shortened it to a week or 2. And then for FDH who are in between jobs, they still have to stay at boarding facilities, but the number would be substantially reduced. And then for these FDH in between jobs, we have started a testing program for them. There is a specimen collection point for them. So when can they take the test? That is, they've completed their old contract, they left the old employer, and they moved into a boarding facilities, and they wait for the new contract application to be processed. During that period, we appeal to them to take the test, especially of course, now they need only wait 1 to 2 weeks for the new contract to be approved. But during that period, they're staying at boarding facilities. So before they start working for the new employer, we believe they should take a test. I'd like to make an appeal to employers of who are hiring FTH here. Before they start working for you, you could ask the FTH whether they've taken the test, and if their test result is negative, then it's more reassuring. So we have more or less completed the testing program for these two clusters, and also completed the follow-up action. But unfortunately, yesterday there's some small cluster coming out that is an NGO's residential care home for the disabled in Lei Mok Shui. There's a small outbreak there. And now, for staff of residential care homes for the elderly, disabled, and so on, we carried out a testing program for them. And in the second round of the test, 3 workers tested positive. So immediately, for residents in that care home and other close contacts, we have arranged testing for them. I think the Center for Health Protection will be announcing later today that they have indeed found a few confirmed cases in that cluster. So this is a new small cluster. But as I said earlier, it is impossible to stop imported cases altogether. Similarly, in a community, there may be a small cluster outbreak from time to time, and it cannot be avoided entirely for the time being. What is important is that we are able to respond swiftly to such cluster, so we could cut the transmission chain in a cluster. And then for people in a cluster who need to be tested, we will test them as soon as possible, so we could prevent others in the facilities from getting infected. The third aspect of our work is that the SAR government will expand the scope for targeted group testing. Now, different departments are doing that. We completed a round of testing for frontline staff of the Hong Kong Post. They all tested negative, and then we moved on to the Environment Bureau. There are also frontline staff in contact with the public, and then the Agriculture, Fisheries, and Conservation departments also have frontline staff, and we've done testing for them, and also for fishermen, we're doing testing for them. Here, I would like to make a clarification again. I heard that some in the healthcare sector say that if you have testing capacity, shouldn't you focus on the targeted groups? Why do you want to start a universal community testing program? Now, I must stress again here that the two types of testing schemes, are not related in any way. Now, with Department of Health has to do diagnostic testing or testing for public health surveillance purpose. This capacity remains. We're not going to use such capacity for the universal community testing scheme. Now, we're able to do the universal community testing schemes because of support from the Central People's Government. This is additional capacity of a massive scale. That's why we're now able to do the universal scheme. So I hope doctors would appreciate this, especially for those who made those comments. Now, for epidemiological or for pathological testing or target group testing, of course, they are more effective from the point of view of public health surveillance. And we are not going to undermine the effort in this respect. Now that the epidemic is easing, I see that the Department of Health and the Hospital Authority are doing fewer tests now as a matter of course. Now, before they were testing 12 to 14,000 samples a day, but now they're only testing a few thousand samples because there's no need to do so many tests for clinical purpose or for treatment purpose. So I hope doctors wouldn't advance such views on the, especially negative views on the universal community testing scheme, just because they are not fully aware of the situation. And another aspect of our work is that on Friday we mentioned that that we were in discussion with operators of the various closed scheduled premises. That is, if we are to reopen these premises, how could we do so in an orderly manner? Now, the Chief Secretary has met with the catering sector and those operating sports venues and beauty parlors. I'm sure you've read that in the news, and we are still continuing with this effort. And I must express my gratitude to those in the sectors for coming up with positive views despite the huge challenge they face. Finally, is the launch of the Universal Community Testing Scheme, so that now the secretaries, department secretaries and directors bureau have been making appeals every day. They're making all the preparation necessary for the scheme, and everything is going well. So I would like to make an appeal to the public again, for your own safety, for your loved ones, and for Hong Kong to identify the silent carriers as soon as possible, so we could come out of the epidemic soon. I would appeal to the public to take part actively in the universal testing scheme. Thank you. Floor is now open for questions.